Have you ever felt like you were expected to agree to a medical procedure simply because of your age? Many people over 70 experience moments like this in a doctor's office. A procedure may be described as routine, necessary, or even urgent, and the explanation can sound so confident that questioning it feels uncomfortable. Some seniors worry that asking too many questions might seem disrespectful, or that delaying a decision could put their health at risk. Because of this pressure, many people accept surgeries without fully understanding the long-term effects or the possible alternatives that may exist. The truth is that reaching the age of 70 does not mean every recommended procedure is automatically the best choice. Medicine has advanced greatly, and many surgeries can truly improve lives. However, the body changes with age, and the way it responds to stress, anesthesia, and recovery can be very different compared to earlier decades of life. What once felt like a routine operation at age 50 might carry greater risks at age 75 or 80. Healing may take longer, energy levels may decline during recovery, and complications can sometimes affect independence or cognitive clarity. This does not mean seniors should avoid medical treatment or ignore professional advice. Instead, it means that decisions should be made with careful understanding and thoughtful discussion. Every procedure has potential benefits, but it also carries risks, and those risks can become more significant as the body ages. Understanding the full picture allows you to make choices that protect not only your health, but also your independence and quality of life. In this video, we will look closely at 6 surgeries that older adults should approach with caution. These procedures are not always wrong, and in some cases they may be the right solution. The goal is simply to help you recognize when it might be wise to pause, ask deeper questions, and explore whether less invasive options could be just as effective for your situation. One procedure that is frequently suggested to seniors who struggle with long-lasting back pain is spinal fusion surgery. On the surface, the idea seems simple and logical. If parts of the spine are worn down, unstable, or damaged, joining 2 or more bones together might appear to solve the problem by creating stability. Doctors may show imaging scans that reveal thinning discs, arthritis in the joints, or structural changes in the spine, and these images can look alarming. When you see those pictures, it is easy to believe that surgery is the only way to correct what appears to be serious damage. However, the spine naturally changes as we grow older. Discs lose some of their thickness, joints stiffen, and small degenerative changes become common after the age of 60 or 70. These changes often appear dramatic on scans, even when they are part of the normal aging process rather than the true cause of pain. The danger begins when an image becomes the main focus instead of the person's actual symptoms, daily mobility, and overall quality of life. Spinal fusion is not a minor procedure. It usually requires general anesthesia, involves significant stress on the body, and can require months of recovery and rehabilitation. For older adults, healing can be slower, and bone density may be reduced, which can affect how well the spine adapts after surgery. Some individuals go into the procedure expecting immediate relief, but instead face a long recovery period where movement becomes limited and strength must slowly be rebuilt. In many situations, conservative approaches can provide meaningful relief without the physical strain of major surgery. Structured physical therapy, strengthening the muscles that support the spine, maintaining a healthy weight, and using anti-inflammatory strategies can significantly reduce discomfort for many seniors. These options may not sound as dramatic as surgery, but they often help restore mobility and function while avoiding the heavy risks that come with invasive procedures. Another procedure that is sometimes recommended to older adults involves surgery on the carotid arteries, the blood vessels in the neck that carry oxygen-rich blood to the brain. When medical tests show narrowing in these arteries, it can immediately raise concerns about the possibility of a stroke.
Because stroke can lead to serious disability, the idea of surgically clearing the artery may sound like the safest and most responsible choice. Doctors may explain that removing the buildup or placing a stent could help restore proper blood flow and reduce future risk. Hearing this information can make the situation feel urgent, even when symptoms are mild or completely absent. However, for many seniors, the decision is not always so simple. Procedures on the carotid artery, whether they involve surgical removal of plaque or the placement of a stent, come with their own set of risks. These procedures require anesthesia and delicate work around vessels that supply blood directly to the brain. In some cases, complications such as bleeding, stroke during the procedure, or reactions to anesthesia can occur. While these operations may provide clear benefits for patients with severe blockages or recent symptoms like temporary vision loss or weakness, the balance of risk and benefit may be different for someone with only moderate narrowing and no warning signs. Fear can strongly influence medical decisions in these situations. When a test result mentions a percentage of blockage, it can sound alarming and create a sense that immediate action is necessary. Yet many studies have shown that careful medical management can significantly lower stroke risk for certain patients. Controlling blood pressure, improving cholesterol levels, maintaining a healthy diet, staying physically active, and using appropriate medications can often stabilize the condition effectively. For some seniors, regular monitoring and lifestyle adjustments may provide strong protection without exposing the body to surgical stress. The most important step is understanding the severity of the blockage and whether symptoms are actually present. Taking time to ask questions and explore all available options can help ensure that the decision made truly supports long-term health and independence.
Knee replacement surgery has become one of the most widely performed orthopedic procedures, and for many people, it can truly restore mobility and reduce severe pain. However, when older adults are dealing with mild or moderate osteoarthritis, the decision to replace a knee should be approached with careful thought. As the body ages, the cartilage that cushions the joints gradually wears down. This can lead to stiffness in the morning, occasional swelling after activity, or discomfort when climbing stairs or standing for long periods. These symptoms can be frustrating, but they are also a very common part of the natural aging process. Medical imaging, such as X-rays, can sometimes make the condition appear worse than it actually feels in everyday life. A scan may show narrowing of the joint space or rough surfaces where cartilage has thinned, and those images can look severe. When patients see these results, they may assume that surgery is the only way forward. Yet many seniors are still able to walk, perform daily activities, and maintain a reasonably active lifestyle despite these changes. It is important to remember that knee replacement is a major operation. The procedure involves removing damaged parts of the joint and replacing them with artificial components. This process requires anesthesia, surgical cutting through muscle and tissue, and a recovery period that can last several months. Rehabilitation after surgery is essential and often involves regular physical therapy, strength training, and exercises to restore balance and mobility. For older adults, especially those who may have other health concerns, such as heart disease, diabetes, or reduced muscle strength, the recovery process can be demanding. In some cases, the effort required for rehabilitation may be more difficult than expected. Because of this, many specialists encourage patients with mild symptoms to explore conservative options first. Strengthening the muscles around the knee can significantly reduce pressure on the joint, improve stability, and lessen pain during movement. Weight management, regular low-impact exercise, physical therapy, and anti-inflammatory lifestyle habits can often provide meaningful relief. These approaches may not offer an instant solution, but they can help preserve mobility and delay the need for surgery.
Taking time to strengthen the body and carefully evaluate the severity of symptoms allows seniors to make a more confident and balanced decision about whether knee replacement is truly necessary. Heart procedures often create a strong sense of urgency, especially when doctors discover narrowing in the arteries that supply blood to the heart. When people hear that a blockage has been found, it can immediately trigger fear of a heart attack. Because of this, coronary stent placement is frequently recommended to open the artery and restore blood flow. In emergency situations, such as during an active heart attack, this procedure can truly be life-saving and may quickly prevent further damage to the heart muscle. However, for many seniors over the age of 70 who have stable heart disease and mild or controlled symptoms, the situation may not always require immediate intervention. Stable heart disease means that although there may be narrowing in the arteries, the condition is not causing severe or rapidly worsening symptoms. Some people may experience mild chest discomfort during heavy exertion, while others may not feel any symptoms at all. In these cases, modern medical treatments have become very effective at controlling the condition. Medications that manage blood pressure, lower cholesterol, and reduce the risk of clot formation can significantly protect the heart when combined with healthy lifestyle habits. A coronary stent procedure involves guiding a thin catheter through a blood vessel, usually from the wrist or groin, toward the heart. Once the catheter reaches the narrowed artery, a small metal mesh tube is expanded to hold the vessel open and improve blood flow. Although it is less invasive than open heart surgery, it still places stress on the body. Complications such as bleeding at the catheter site, kidney strain from the contrast dye used during the procedure, or irregular heart rhythms can occur, particularly in older adults whose bodies may not recover as quickly from medical stress. For many seniors, careful medical management can sometimes provide similar protection against heart attacks when the disease is stable. Improving diet, staying physically active, controlling blood pressure, lowering cholesterol levels, and participating in supervised cardiac rehabilitation programs can strengthen the heart and reduce risk over time. These strategies may not sound as dramatic as a procedure, but they can play a powerful role in maintaining long-term heart health. Taking time to understand whether symptoms are stable and discussing all available options with a cardiologist can help ensure that any decision made truly supports both safety and quality of life.
The final situation that deserves careful consideration involves aggressive surgery for slow-growing cancers. Hearing the word cancer can instantly create fear and a strong desire to remove the problem as quickly as possible. Many people believe that immediate surgery is always the safest choice, and in some cases that is absolutely true. However, after the age of 70, not every cancer diagnosis requires urgent or highly aggressive treatment. Some tumors that are commonly found in older adults grow very slowly and may not threaten health in the same way that fast-growing cancers do. Conditions such as certain prostate cancers, small kidney tumors, early thyroid nodules, or slow-developing lung nodules may progress at a very gradual pace. For younger patients with many decades ahead of them, removing the tumor quickly may offer long-term benefits. But for seniors, the balance between the potential benefits of surgery and the physical stress it places on the body can be very different. Major cancer operations often involve long periods of anesthesia, significant strain on the heart and lungs, extended hospital stays, and lengthy recovery times. For older adults, recovery after such procedures can be challenging. Some seniors experience confusion or memory problems following surgery, a condition often referred to as postoperative delirium. Others may face weeks or months of reduced mobility while the body heals. These effects can sometimes impact independence and overall quality of life. Because of this, doctors may recommend an approach called active surveillance for certain slow-growing cancers. This strategy involves regular monitoring through medical exams, imaging tests, and follow-up appointments, rather than immediate surgery.
Active surveillance does not mean ignoring the condition. Instead, it allows doctors to carefully track whether the tumor is changing or becoming more aggressive. If signs of progression appear, treatment can still be started at the appropriate time. For many seniors, this approach helps maintain daily routines, independence, and comfort without exposing the body to unnecessary surgical stress. The key is understanding the specific type of cancer, how quickly it is likely to grow, and how overall health influences treatment options. Thoughtful conversations with healthcare providers can help ensure that any decision made supports both longevity and quality of life.